Ensonga y'endwadde z'emitwe gite mental illness efuuse baana baliwo ensangi zino naddala mu bavubuka awamu n'abaana abakyagenda mu masomero nga okusinziira ku bakugu naddala mu bitongole eby'obwannakyewa awamu ne gavumenti bikola butaweera butassa mikono okulaba nti ensonga eno enogerwa eddagala. So mu bitongole ebyenjawulo naddala ekitongole kya JENGA kivudde olunaku olwaleero okuŋŋaanya abakugu ab'enjawulo omuli abasawo ab'ekinnansi abasomesa awamu n'abakugu abalala okulaba nga batema empenda butya ensonga eno gyeyinza okuba nti erinnyibwa ku nfeete. Era ng'okusinziira ku bakugu n'okunoonyeza okwakolebwa kulaga nti ebitundu 20 ku bitundu 16 ku buli 100 b'Abannayuganda bye batawaanyizibwa ensonga y'obulwadde bw'omutwe era ng'ensonga eno esinga kuva ku kukozesa ebiragalalagala awamu ne stress. So nga wakati bakola butaweera okulaba nti ensonga eno enogerwa eddagala era ng'abakugu batuula wamu era ne bagatta obwongo mu kutema empenda kyekirina okukolebwa mu kulaba nti ensonga eno emalibwawo. Era olunaku olwaleero ekibiina ki JENGA kisikanyeemu abakugu ab'enjawulo n'abantu ab'enjawulo ku kutema empenda buti ensonga eno gyeyinza okuba nga ekwatibwamu oba oli awo n'okuba nti emalibwawo. Ensinkano yonna nga bwetambudde tugenda gikutuusaako ku musana.
Having the highest numbers of mental health challenges. This is substance abuse. We are all mothers, we are teachers, okay, even the teachers are mothers, we are all parents, we are all fathers. We have this biggest problem. In schools, in homes, even the non-school goers are doing this. So I shall not say only in schools, like everywhere in our community. Children have I've decided not to use drugs, but even parents. You're in a ward, this father they have brought, the child is taking care of the father with a bang user. Now they're going to tell your son, you smoke marijuana, you're broken down mentally, and it is your son who does not smoke taking care of you. You'll also smoke eventually. So, I don't know what went wrong, but I think there's a lot of freedom that has been given to our children. He's saying they are copying a lot of Western life. Events are so many. These days, diseases are so many. If you go around to a fair, or Fubobuchiankalana, but Manelenda is not what I is a fair. Like it's too much. Manelenda takes your land title, Manelenda was struggling for so many years to get to that land. Then this Manelenda comes in and takes it in one day. You know, every already have that genetic gene. Things of touch
Amanya nze bisa na muko kusajja mu masaba yekyamaano abasawo bahabu mu nyumba y'omukuka. Tulina minisita mulamba wa Kaliji atakwatagana n'abazungu, ekyo kirala. Kakati ffe nga abamasaba oba abaddugavu tulina ebyaffe byeyawula n'eby'abazungu, mukwata biri ne muyunga nekibeera kimu. Kakati gonoŋŋamba nti kankusabire ate omuntu agenda kufa so nga yandibadde anywa ku ddagala, oyo omuntu nafa naye ng'obulwadde mutwe. Tulina obulwadde ensimbu, ayinza okugamba nti sitaani yemukutte, so mulimu obulwadde obulala bw'ekika kyabwe nga baggwa neffe bagufumula eyo nfuddeyo. Tulina omutawaana omulala bakola obwenge buno simanyi nga bwe balangira ku rediyo buli ssaawa, ndowooza mubuwulira. Abakola obwenge obwo boosi basawo basuubuzi basa abantu baffe babamazeewo, ekyo ndowooza mukiraba. Omwe obwenge bwenge obwo okucupacupa tubumalawo tutya. Omuntu akanywa oli bateesemu ddagala lino simanyi atamiire biki ebitali bisengejje mitwe ezoonooneka. Abaana abasinga obungi banywa bucupacupa buli batoonoonseeko.
Omuntu aloota buli lunaku nga yeebase alwala obwongo. Bagenda n'aloota abafu n'atukwana ekiwe kyonna ng'akola ki, ayina ebimuddusa, ayina kino ekivaamu asobola n'okulwala obwongo obutulo. Ekirala mulimu okuloga, ng'omuntu bamuloze buluzi naye alwala obwongo. Ekirala mulimu ng'olaba omukyalo oli wasomesezzaako taata wange yali mulwadde wa mutwe bajjajja wange ekintu ekyo kizuukira bwe muyinza okuyitawo egurupu ebiri naye nekitwala kiki omuzzukulu n'alwala obwongo. Ekintu ekirala waliwo kakati amadiini gajja ne twerabira ebyaffe ebyaliwo n'ebiti twazimalawo nabyo mu kulwala obwongo biri awo.
My name is Robert Budadira. I work with Mbale Regional Referral Hospital. Today we want to thank God so much that JENGA, the organization, has organized something to do with creating awareness about mental health and how to handle the mentally sick in the community and how to identify them, which has been very good. I must say, JENGA, thank you so much. This mental illness or mental health is a challenge in our community today, not only for some individuals, but at a wide range of coverage. It doesn't segregate in color, in maybe social status, in age. It affects each and every individual, I must say, who has the head like mine. So the situation currently in Uganda is really alarming, and when we come straight away to the eastern region, it is really not good. We see many individuals are suffering from mental illness, particularly the leading right now among the youth and the children is substance use. They use the substances and then they end up breaking mentally. And in our communities, people have not understood clearly what exactly this is, and most of them, they think this is witchcraft. Some of them think they have been attacked by demons. Some of them associate to Mijini, and they waste a lot of time outside there instead of looking for a solution to the hospitals, simply because they are not aware of the services. So I thank JENGA, who has come on today to create awareness among the stakeholders, among the religious leaders, among the traditional healers, the schools around us, the teachers, so that these children, these youth, they can be helped, because they belong to mostly those schools, mostly to the communities where these people come from. By so doing, we hope that mental health will be improved and people will seek treatment. Nationally, we are at 14 to 20% of the national population. When we look at the population of Uganda, which is around 47 million, by then, that is 2023, which was translating to around 6 to 9.4% of the population in Uganda. And when you come to Eastern region, we have something to do with 10 million Ugandans in this region. And out of the 10 million, when we take the 14 to 20% of that population, we find that 20% we get to a population of 14 to 20% have mental illness, and these ones, when you try to translate to figures, you get something to do with 2 million people having mental illness in the Eastern region. The leading mental problem among those to be depression and then substance use disorders. The government is trying to do a lot to ensure there is sensitization, but mostly it has been on radios, it has been on maybe televisions, but according to this creating of awareness and the training we have been in, it needs more than that. It needs to come to the ground, to the community levels, because some people do not afford to be on social media, do not afford to be on radios, televisions, so still people lack information. So the best thing is for this awareness to really go down to the grassroots level, and this meeting having very many stakeholders, they are pledged to go ahead and even do more extra than what it has been like usual.
Lunyolo, Christine Sarah, a teacher of Mbale Secondary School. I work in the careers department as assistant careers mistress. Today we have been studying about mental health and mental illness, and one of the causes of mental illness is the use of drugs, and we are handling it in education, in the education sector. For example, in our school we have had to do a lot of counseling to students against the use of drugs. We have also had to have peer counselors among the students who help us to identify those who have that challenge, and then we have always counseled them, and we have also used fellow students to counsel other students. As a school, we have also opened the gates, our gates, for other organizations that are coming to support our students on mental health and the drug abuse. For example, we were being helped by the people of Strong Minds Uganda. Today, we are incorporating in JENGA organization to help our students in this. Sometimes, we have also involved the parents where need be.
Agnes Masagwai, I am the district senior health educator for Mbale. Today, we have had a meeting concerning mental health and mental illness. As you realize, mental health in Mbale and beyond Mbale is on the rise. But it has been requiring, and it requires intervention from the health department or health arm. For us as a health department in Mbale, what we have done, so far we've been creating awareness on mental health. We've been making sure that we use the structure, the health system structures that are available by Ministry of Health, that is the VHT, who is the grassroots health worker. Right now we have trained 180 CHUs, community extension health workers. We have the health assistants, a structure that refers a mental health patient from the community direct to the health facility. As I talk now, we have health facilities like Health Center 2 at parish level. At sub-county, we have Health Center 3, and we have a Health Center 4, which is the health sub-district. So all these cases, once they are referred from the community into the health facility, there is a provision for assessment and management. If they are having simple cases, they can be managed at our health centers. But if they have complicated cases, we have been referring them to Mbale District, Mbale Referral Hospital. But now there is a challenge. Sometimes when you refer these patients to come, they do not come because of the myths and misconceptions about mental health. Some of them end up going to the witch doctors to remain in the community using herbs, and eventually you find that a case which would have been managed earlier in the health facility misses it out and eventually becomes a complicated case. So it is a challenge. It requires intensive community sensitization, public health awareness through these radios, through the community dialogues, through sensitization in the meetings. All of us must work hand in hand. Looking at the issues of support towards mental health, the funds are really limited to support mental health activities. But if partners come on board to support us, we would love to make sure that the public is well informed, well sensitized about mental health and its prevention. Today in this class we have heard about prevention of mental health, and one in line with the discussion of today was epilepsy. Epilepsy being a very serious cause of mental health, where people convulse, people get issues to do with their brain. In this case, there are drugs at the health centers. The only challenge is sometimes we get stockouts, and these stockouts usually affect the management of these patients. But it would be good to diagnose them early, assess them early, and put them on treatment early, so that we can prevent complications that come along with these mental health issues.
My name is Ruth Odiek. I work with JENGA CDO, that is JENGA Community Development Outreach, and we've had a training today, a mental health consultative meeting with teachers, with heads of the district, education officers, probation officers, and traditional healers have also been a part of our meeting today, and we've been talking about issues to do with mental health and mental illness, epilepsy, how to handle it, when to refer patients to the hospital, and the things we can do in the future to help. We had the training because we've noticed a lot of mental health challenges in schools, in communities where we have visited, and in the health center, the mental health unit, that is Ward 12, Mbale Regional Referral Hospital, and we saw the need to extend some knowledge to these stakeholders so that they can help us down there in the communities, in the schools, in the churches, the mosques, because those are the first people who deal with these patients. So it's very good that we've had this meeting, this consultative meeting, to help us get to the roots of mental health and mental illness. Apart from such engagements, we've had radio talk shows. We've also reached out to schools around Mbale City and Mbale District, and we've also gone to communities around to sensitize them about mental health and its challenges. In the future, we hope that from a meeting like today, we will have more entry into various schools we've not been to. We will have people call us to communities and we reach out to them. Basically, we want to see how much we can do to make sure that people are aware about mental health and its challenges.